Good morning. Good morning, all. We only do this once a week now, so we're missing you, Jay and Vicki. So, all right. Want to say thank you. All right. So, good morning, everyone. Thanks to Vicki and Jay, as always, for interpreting. As always, we're going to start with the numbers this morning. The number of positive cases confirmed in Hamilton County are 2,918. The difference between last time we were here, which was last Wednesday, so a week of data, the difference is 177. The number of folks that have been hospitalized is 595. The delta is 46 from last week. And the number of deaths in Hamilton County are 173. The delta there is 17. Today, we are going to hear from Interim Public Health Commissioner Greg KESTERMAN on the virus trends and what the current state of spread is in Hamilton County. He's got a couple graphics that I think are will be very informative related to testing sites that are available and the trends that we're seeing, and I'm going to leave him to discuss all of that. He is the expert in the field. Second, we are going to hear from Clerk of Courts, AFTAB PUREVAL, who will talk about the one-stop help center over in the courthouse that his office has set up for people who are in the eviction process, lending assistance to those individuals and landlords trying to make sure that if folks can stay in their apartments, they are doing so successfully with some of the work that's happening through the one-stop shop. Before we get to them, we have a couple of other things to announce and talk about. I know these briefings are about primarily COVID-19 and the county's response to COVID-19 in our community, and I think it's important information to convey. But we have other things going on in our community, and so very briefly, I just want to touch on what's been happening by way of protest and forward progress related to what we're hearing from members in our community who are in the streets, in our communities, talking about some of their concerns about racism in this community and what happened to George Floyd. So in a week's time, we have had a multitude of peaceful protests in our community. I want to thank the protesters and law enforcement for making sure that the protests have been peaceful. Everyone should have the opportunity to speak their mind in a safe space. As you know, and as we mentioned in our previous briefing, the Board of County Commissioners is working on a comprehensive response to the concerns that we're hearing to provide a thoughtful path forward regarding the systematic racism that exists in our community. We hope to incorporate lessons learned from programs that we have already initiated in the county. We can learn from the city's collaborative agreement that happened 20 years ago and the refresh that's underway right now. We will learn from other communities, for instance, Franklin County, and what they're doing and what is incorporated in their initiatives. And then the ideas that are bubbling up from our own community and from some of the folks that we have interfaced with as we've gone out and talked to protesters in the street. It's an important conversation to have, but we do want to be thoughtful and careful about how we roll things out. And so Commissioner Parks is taking the lead on the initiative, and she has said we will have something in front of us probably in a couple of weeks. So that is an update related to the issues, kind of the issue of the day. I also want to talk a little bit about the CARES Act funding that is related to rental assistance, which rolls right into the eviction work that AFTAB PUREVAL is doing. And I want to mention also that Councilmember Greg Landsman has been a part of that effort. So eviction court opened up this week on Monday, and we're focusing intensively on the portion of the CARES Act that is critically important for many of our citizens related to rental assistance. The Rental and Utility Assistance Program will employ the services of organizational partners to administer rental and utility assistance to Hamilton County residents who cannot pay rent due to decrease in income as a result of COVID-19. It is proposed to allocate up to $3.5 million of the $5 million that's been earmarked in the CARES Act funding towards this initial effort. The remaining $1.5 million will be set aside for additional resource needs identified related to the eviction prevention work that's going on over in the courthouse. Hamilton County is currently issuing a request for proposal to contract with an organization or organizations to administer the program. So the RFP is currently on the street. Residents would apply for assistance through the administering agency, and that administering agency then will cut the check to the landlord. The program is focused on rental assistance. We continue to explore mortgage and foreclosure prevention assistance to better understand the need and current resources available, but don't want to hold up the rental assistance while we do that research. So we're moving forward on the rental assistance piece. Under the program, residents would be eligible to receive rental assistance if their households meet the following draft criteria. They experienced a documentable decrease in income and employment due to COVID-19 through this public health emergency. So things that could be provided to prove that would be an unemployment letter, a furlough letter, check stubs noting the decrease in wages, a letter from an employer. You get the idea, something where the renter can prove that they've had a decrease in income related to COVID-19. The household would earn 80% of the area median income, and I had a chart. I'll try to find, it's not in my notes, but I can give you a better idea of what that means. Reside in Hamilton County, have proof that rent or utility payment is past due, self-attest that they have no more than $10,000 in liquid assets, and attest that funds are directly and exclusively related to housing instability caused by COVID-19. So I'll keep you up to date as to the RFP process. We're trying to move these things quickly, so we'll have that out for a few weeks, let the agencies respond, and then move forward with these partners to get that assistance out to folks that are worried about losing their housing. Next, a quick update on the Small Business Relief Program. Remember that has, the window on that one opened and closed. We had a lottery for the businesses that applied. They could apply for various amounts of money depending on what the impact was of COVID-19 to their business. So currently we have 150 businesses that have been recommended for funding. There are about 200 businesses in the queue. We're still in the process of vetting those, but hopefully those will be quickly verified and the funding will be out the door to them as well. We expect to wrap up this initial round of funding later this month. Afterwards, we're going to evaluate, understand lessons learned, and potentially do another round, probably expand that criteria a little bit to capture more of the businesses that are struggling and then move forward, because we expect to have a little bit left over there, and so we want to make sure that we're hitting the mark with the funding. Finally, on kind of a fun note, we are excited that the Cincinnati Zoo is reopening today. The Cincinnati Zoo and Botanical Garden is a treasure that serves Hamilton County residents and millions across Ohio and and outside our region and really throughout the nation. It's been closed for nearly 3 months. So it will reopen in phases following the governor's guidelines to safely restart Ohio. We have America's #1 zoo right here in Hamilton County, and I'm pleased that their gates are reopening to provide important educational and recreational services for our community. Go to their website for additional details. So without further ado, I am going to turn this over to Greg KESTERMAN. And as I said, I've had the privilege of seeing Greg's slides, and they're really informative. And really, I've had the privilege of working with Greg over the last couple of months as we work through the dynamics of global pandemic that have hit our community pretty significantly, but not as bad as it could have been. So I know you're going to talk about the curve and what we're seeing by way of the data points. So, Greg KESTERMAN.
Thank you, Commissioner, and I'm happy to be here today to provide an update. I always like to add one piece of data to the Hamilton County numbers. Here in Hamilton County, so outside of the jurisdictions of Cincinnati, Norwood, and Springdale, we have 1,588 cases, of which 733 individuals have recovered. So that's always great news to be able to share. I want to touch base on a couple current trends. So if we could open up the slide there. On the slide in front of you, you are seeing statewide data related to COVID-19 and the number of cases, deaths, intensive care unit hospitalizations, as well as just hospitalizations. And I think the thing that strikes me the most when looking at this data is those trends remain fairly flat. They do jump at moments and decrease at other moments, but overall, over the course of the last 21 days, we've not seen anything alarming in this data. So that's good news. Last week, I shared a slide regarding the reproductive value. And just as a refresher, the reproductive number is an indicator of contagiousness or transmissibility of infectious diseases. So on the next slide there, you can see in Hamilton County, our reproductive number currently is 0.87, and the region, so a 13-county region, is 0.89. Those are the counties obviously surrounding us. If the reproductive number is less than 1, an outbreak will continue to die down slowly. If the reproductive number is greater than 1, we see the outbreak continue to spread. So about a month ago, we had an R value that was close to 2, and that was significant because that meant for every individual that became ill, we'd see approximately 2 more people get sick. And so that's how the disease spreads. For reference, 2 weeks ago, the R value here in Hamilton County was 1.22. Last week when I was here sharing information, it was 0.74. And as I just mentioned, this week we're at 0.87. A slight increase from last week, but once again, nothing concerning. These values do come up and go down as time goes on. Commissioner Dreihaus shared information about testing sites here in Hamilton County. We have had a great list on our website that we've been maintaining, sharing all testing locations that we're aware of with information regarding where to get tested and what you need to do to get tested. After spending some time and hearing some feedback, we decided that list was helpful, but what would really be the most helpful is a map so that you can go visit your house or you can go visit the map and see where your home is and which sites are closest to your home. If you click on any of those points on the map that you're seeing on the display, if you change to the next slide, you get a dialog box that pops up, and that explains exactly what you need to do if you choose that site. It tells you if you need a physician approval prior to going. It shares the hours and the phone number and the address. So I strongly recommend you visit hcph.org and go to our COVID-19 page and utilize this resource. We will continue to keep it up to date, and if there are sites that that you know of that are not on our map, please share that with us, and we will continue to keep this as the best resource here in Hamilton County. So I wanted to give a few updates with regards to some reopenings. As summer gets underway, we look forward to see some new openings. The governor announced on June 19th, we have casinos, racinos, amusement parks, and water parks opening. We already know that swimming pools are open with some restrictions on how they're allowed to operate. All of the guidance is found on CORONAVIRUS.OHIO.GOV. A vast wealth of information can be found there, and I'd encourage folks to check that out as well. In all cases, these guidance documents have kind of the same group of principles across the business sectors. For example, one item is reducing the number of people within the business. This allows for better spacing. Separation of groups, so you see in the restaurant industry, we require no more than 10 people per table, and tables be 6 feet apart, so that separation is happening. And then lastly, the increase for sanitation. We know that sanitation reduces the spread of germs, including COVID-19. The governor also shared with nursing homes. Nursing homes are still restricting the number of restricting visitors completely, except for the governor did announce that on June 8th, outdoor visitation is allowed if the nursing home is willing to do so. So that's good news for folks who are living in nursing care. Detailed guidance, once again, is available on the state's website. Additionally, the Ohio National Guard is doing testing of nursing home employees throughout the state of Ohio, including here in Hamilton County. There are 2 nursing homes that are being tested this week from the Ohio National Guard. The goal is to get in, test the employees, make sure we find out if individuals are sick, and then quickly isolate them so they don't cause any spread of disease within the nursing home environment. I will stop there and turn it back over to Commissioner Dreihaus.
Can I ask you a question?
Yep.
I know I'm off camera, sorry. When you talk about the testing sites, can you?
Absolutely. So the testing sites, once again, check out our map, and if you click on the link, it does tell you what's needed at each testing site. It's really, each site has different requirements. Some sites require a doctor's note, some sites require an appointment, and some sites require neither of these. You can just show up and get tested. I would recommend, if you select the site that you would like to go to, always call first so that you don't go and be disappointed that you can't get the test. We want it to work right on the first try. Yep.
All right, thank you, Greg. Thanks so much for that information. So next, AFTAB PUREVAL, the clerk of courts, is with us this morning. A lot of work has been going on over at the Self-Help Center, established how many years ago, AFTAB? 2 years ago. So this is not new work. It's very important work, especially at this moment in time when we have so many people struggling to pay their rent. And so AFTAB and, as I said, Greg Landsman have done a lot of work in partnership with others to make sure that if people can stay in their homes, we're making sure that happens. So with that, I'm going to let AFTAB expound on what's going on over at the courthouse.
Good morning. Thank you, Commissioner Dreihaus, for inviting me here today and for your leadership and partnership on this very important issue. As you may know, on Monday, Hamilton County resumed eviction hearings. We currently have over 1,000 evictions pending in our court system. And this presents a dire situation for families in our own community. We're in the midst of a global pandemic, as you just heard, and record unemployment. So now is not the time to be evicting people from their homes. To combat this problem, this challenge, my office at the Clerk of Courts has launched an eviction help center in room 115 of the Justice Center, directly across from room B, where eviction hearings are taking place. This is a one-stop shop that will enable both landlords and tenants to get limited legal advice, to learn about resources available to them, and probably most importantly, to apply for financial aid so that they can stay in their homes. Representatives from St. Vincent de Paul and Community Action Agency will be available at the Help Center to walk applicants through the applications for emergency rental relief. We also created a new search on our website to enable landlords and tenants to more easily find out their eviction dates, because understandably people are confused about when their hearing is scheduled. And we worked with the city to send everyone facing eviction a postcard with information about resources available to them. But as evictions start, we know that we have more to do. What we're expecting in the next month or two is an eviction crisis, an overwhelming situation of more renters getting behind on their rent. Our shelters simply cannot handle this kind of need, and we all know the damage that homelessness does to children and families. That is why we're so grateful to Commissioner Dreihaus for her leadership for securing CARES Act dollars to help with rent assistance. As you heard, Hamilton County has $5 million earmarked. $3.5 million are already on the street now to make sure that landlords get paid what they're owed and renters can stay in their homes. We're racing the clock here to get the money allocated before it's too late. So if you've fallen behind on your rent, or if you're a landlord owed rent, please visit the Help Center at cincyhelpcenter.org. Go to our website and get the information you need to start on this now to avoid an eviction. Too many families in our community are in jeopardy right now. They are more than just names on a court case. They are our friends and neighbors, our brothers and sisters. Just on Monday, the day evictions hearing started, we met a woman named LaShonda. She lost her job as a nurse's aide. She has 6 children, 3 that worked at restaurants but got laid off due to the epidemic. Then the family car broke down. And being out of work, they could no longer afford their rent. If she doesn't get help, she and her 6 children will be out on the streets. That's what we're up against. That's why we're working so hard and so fast to get resources to the people who need them. So come visit the Help Center and get the tools you need to pay your rent and to stay safe and healthy at home. Thank you so much.
Thank you, and thank you for your leadership on that issue, AFTAB. So I'm going to revisit what I said earlier about one of the qualifiers for the rental assistance program. I mentioned 80% of AMI, area medium income, and so let me give you an idea of what that means. So for a family of one, it's just over 48,000. A family of two, it's just over 55,000. A family of four, just over 69,000. So that gives you an idea of who will qualify for that program. So with that, Bridget, I believe we're ready for questions.
Yeah, Jay Hanselman is up first. He has questions for you, Health Commissioner Greg Kesterman.
Good morning, Jay.
Good morning. Thank you, Greg. A couple of these will be very quick. When you talk about the reproductive number, is that the same thing as the R0 number that the governor and state health director talk about?
Yes, they're all very similar and related, but yes, it is the same.
And for the region or for the county, is that information available for the public to find online or just when you do these briefings?
It's currently available only during the briefings. I can post the slides, and actually I will post the slides on our website, particularly to the R value once a week on Wednesdays.
And from what you talked about this morning, what should the public take away from the data that you presented this morning about that reproductive number?
So I remain very cautiously optimistic that things are going very well. I've been nervous with all of the people gathering downtown, as well as with all of the gatherings associated with Memorial Day. We are now 2.5 weeks just about past Memorial Day, and we've yet to see a spike, which I think is very good news. We know it is summer. We know that colds and flus typically do not do well during the summer, and I am personally hopeful that the same will hold true for COVID-19. That said, COVID-19 has never been here for a summer, so we won't know the answer to that question until we kind of make our way through summer.
You mentioned some of the things that were happening downtown, and that brought up another question, social distancing and mask. I see a lot of people wearing masks, but they're not social distancing. Is it one or the other, or should it really be both? Even if you're wearing a mask, you need to watch your distancing.
You know, the truth is, the more steps you can take, the safer you'll be. So if you can leave 6 feet and you can wear a mask and you have physical barriers, the chance of getting sick is significantly reduced, almost to zero. That's not true in most situations. We can't do all three of those things. And so if you're able to wear a mask and stay 6 feet, that's even better. And obviously in workplaces, there are times where if you're working in a fast food restaurant, you just can't have that 6 feet of distance. And so that's where wearing the masks really helps protect those individuals around you. So ideally, individuals who are at the protests will wear a mask and make sure they're keeping people safe around them. I think it really also sets the tone that you care. So I really encourage people to wear those masks.
And I promise this is the last one. Could you speak about the number of complaints that you've been receiving? Are they holding about what they had last week? I think you said they were about 15 a day.
They are about 15 a day. I believe they dropped slightly. I want to say closer to 12 per day, but they continue to come in, and they seem to be the same types of complaints. We're continuing to get complaints about social distancing and masking.
Thank you.
And that appears to conclude our questions.
Oh, my goodness. Well, no more questions. All right, so we must have been very thorough today. So thank you again for listening in. I want to convey just a quick story. Yesterday, I was out after work, and I went to a shopping plaza, and there was come to find out there was a sale going on in the store that I wanted to go into. I didn't know that at the time. I may have picked a different time to go. But anyway, it was very crowded. And the folks in the store were being very diligent about keeping people distanced in that store by limiting the number of people in there. And so we all had to line up on the sidewalk outside. This was after the rains. And there were X's on the sidewalk. And to the credit of everybody in the store, and everybody in that line, because it was a long line, it was a pretty good sale, everybody stayed on the X. They did not grumble about it. Everybody had a mask on. And so I just want to say that while we are worried about a spike in this community, and I think rightfully so, so far we're holding steady, and it's been pretty level and pretty flat. And I just want to say that it's a tribute to all the folks in this community who are still taking this seriously as they are out and about. Yes, sometimes people are close to one another, but they're masked. Other times, when able to distance, they do it. So I think that is the reason we're seeing what we're seeing in this community. So a credit to everyone. We will be back next Wednesday, unless we need to be here sooner than that. I don't anticipate that. I think we have been kicking around something that's been going on kind of below the radar, which is related to addiction in this community. We are seeing a significant increase in folks that are overdosing in our community. I've been talking to some of the treatment specialists and the providers, and we need to get a handle on this. Providers are still providing services. Sometimes they are virtual, as you might imagine, but they are still open for business. Emergency rooms are safe, and the QRT is back out on the street. And so we're going to dig in a little bit on those numbers to try to understand that, because we are losing folks to addiction right now in numbers that we haven't seen in a while, and it's very concerning. And so we are likely to focus on that next Wednesday. So again, be safe. Thank you. Hope we didn't work you too hard here. You can't see that he's sweating, but it's really Greg's fault, because Greg talks too fast. I don't know. So thank you all. I know, sorry, you can't interpret that. All right, see you next week.